Good morning. Good morning, everybody. Please come on in, take your seats, have a seat. I am so excited to be with all of you today for today's 2023 Hot Issues in Health Conference. I am Sarah Schmidt. I'm the president and CEO of the Colorado Health Institute. Thank you. We have over 200 people who are here in this room today, and we have just as many, if not more, who are joining us virtually from across the state. And could we do a quick change of the screen to say hello to our virtual participants? Can we do that? Oh, look at all these people. Anyone want to come off their camera and wave hello to the stage? A little wave? They're like, no. We're taking the conference from the bedroom, from the bed today. Fair enough. Great. Thank you, everybody. So however you are joining us today, whether you are here in this room or joining us virtually, you are all welcome at Hot Issues in Health. It is a time every year when we come together to make new connections, to challenge the things that we think, the ideas that we have, and to find new partners who help us advance the work that we all do together to address health and health equity in Colorado. And we have so much good stuff in store for you today. We've got renowned speakers who will be coming up on this stage, leading us through some interesting and provocative conversation around artificial intelligence. We will have young people coming up here telling us what they think about social media and the impact that it has in their lives. And there's a lot more. If you've got a program, please reference that because that will give you everything you need. All right, thanks very much to sponsorship from the Rocky Mountain Health Plans, a United Healthcare company, and the Colorado Health Foundation. All of our content today on the stage will be translated by Community Language Cooperative. So I would like to invite Danielle up to the stage to tell us how that is going to work.
Good morning. Good morning.
It might take a minute.
Good morning. Buenos días. I'm Daniela Short with the Community Language Cooperative. Soy Daniela Short with the Community Language Cooperative. Y estoy aquí para ofrecer interpretación simultánea en inglés y español. I'm here with my coworker Suli to provide simultaneous interpretation between English and Spanish. And so you may hear a little murmur in the back of the room sometimes. We are doing our job and we'll try to keep it quiet. Si escuchan ruido aquí al fondo del salón es porque estamos trabajando. A couple of things that will help this move smoothly. And of course, all of this is so that we can provide a space that is really respecting the principles of language justice, where everyone can listen and participate and speak in the language of their heart. Entonces todo esto es para poder ofrecer un espacio de justicia del lenguaje donde todos puedan participar, escuchar y hablar en el lenguaje de su corazón. So a couple of things, when there is participation in the sessions, we please ask that you speak up. We need to be able to hear you over the sound of our voices. Also speak at a nice conversational pace because it takes about 20% longer to say everything in Spanish that you say in English. And we also ask that you speak one person at a time so that we don't have to choose who that we are interpreting for. Entonces pedimos, cuando hay participación en los salones, que hablen una persona a la vez para que no tengamos que escoger para quién interpretar, que hablen en voz alta para que escuchemos bien y también que hablen a un ritmo conversacional para que podamos quedar a tanto. Si hay problemas con el equipo, por favor avísenos. A veces hay que volver a apagar y volver a prender el equipo. Just letting folks know if there's any trouble with the equipment, let us know. Sometimes we just need to turn it off and turn it back on. And if any questions, any issues, please just let us know. Thank you so much.
Thank you, Danielle. Okay. I also want to acknowledge on behalf of the Colorado Health Institute that the land on which we are gathering today for our conference is the traditional territory of the Arapaho, the Cheyenne, and the Ute peoples who are still with us today. And we also acknowledge that there are 48 historical tribes that are connected with Colorado from across the state. And many of our virtual participants are on those lands as well, too. We commit to working on policies and programs that address past and current inequities and improve health. Now, I would like to invite CHI board member K. Ramachandran to the stage.
So I came up with Brandon not because I dressed from the shoes up, but because I have a new hip. Is this working, Sarah?
Let's bring it in a little closer.
Can you hear me now? Yes. Perfect. Good morning. I'm K. Ramachandran, and I serve on the Board of Trustees of CHI. And on behalf of the Board of Trustees, I want to thank each and every one of you who are here in person or virtual with us. In my other life, I'm the CEO of Marillac Health, the federally qualified health center for Mesa County. And along with another board member on the Board of Trustees, we too represent the Western Slope on the board. When Michelle Leek, the former CEO, approached me a long time ago to serve as a board member on the Board of Trustees, I had absolutely no hesitation. I've always admired and continue to admire, even today, CHI's statewide focus, its commitment to rural health, and also to healthcare access. The last 3 years have been unprecedented in every industry, most in healthcare. Even those of us who'd worked for very long in healthcare, everything we did was challenged. We had to be nimble, creative, courageous, fearless. We did things like stand up telehealth in 5 days, use aging buildings where the entrance couldn't be the exit anymore, use narrow corridors to keep our patients safe 6 feet apart from each other, motivate our workforce, but more than ever to motivate and keep our patients safe. And nothing says it all better than bringing people under one roof like a forum like this to talk about common challenges and also to talk about creative solutions. I would encourage each of you, participants in the conference today, reach out to people you don't know. There could be an opportunity in the making or a partnership forging. I would like to recognize a few people in the room, members of the Board of Trustees of CHI, if you could please stand up. Thank you for your service, and it's a great privilege to serve alongside you. Staff of CHI, who with very little fuss and noise put this excellent conference together. Could you please stand up? And if we have any elected officials, we would like to recognize you too. Enjoy the conference. I'll pass it on to Sarah. Thanks, Sarah.
Thank you. Thank you, Kay. All right. I am now excited to welcome Patrick Gordon, the President and CEO of Rocky Mountain Health Plans, a United Healthcare company, up to the stage. Rocky is our health equity champion sponsor and is supporting all of the translation and the equitable access that is happening for the conference today. So thank you, Patrick.
Thanks, everybody. Good morning. It's great to be here. Like Kay, I have been a longtime fan of CHI. I have always appreciated their work, the intellectual honesty they bring in their analysis, and that's really critical at times like this in a state like ours, which is full of challenges, but also full of opportunity. Rocky Mountain Health Plans, many of you know our organization. We've been on the Colorado scene for about 50 years. And our mission has long been aligned with the themes we're talking about today, because the themes we're talking about today are decades-old problems. Back in the day, communities like the Western Slope were confronting issues of access and quality and equity. We didn't call it health equity back then, but the reality is that we knew as we all do now, that there really cannot be health without community, and there can't be community unless there's an intentional effort to include everybody. So again, as we talk today and work through the discussion, we're tremendously proud to be a part of solutions that are emerging in Colorado to close the ongoing disparities we confront. But this is an exciting time. We have a tremendous opportunity to expand coverage. I want to give a shout out for everyone who worked on the OmniSalud program. Okay, so OmniSalud was new last year. In a matter of days, the available slots filled up. This year, for 2024 coverage, 11,000 slots went in less than 30 hours. So that really underscores the need, and that underscores the importance of making sure we sustain programs like OmniSalud with sound financing and policy decisions. But that's a major step forward, and I'm very proud to be a part of Colorado when we look at programs like that. I'm also incredibly excited about the opportunity to accelerate behavioral health integration in the state, clinical integration, payment reform. All of these topics, all of these buzzwords are means to an end, not the end itself. But the end itself is a much more inclusive, equitable, and affordable health system. And CHI has always been, a tip of the spear in that work and in that mission. So anyway, without further ado, thank you, Sarah. Thanks, everybody. And let's enjoy the day. Thank you.
And thank you to Rocky again for their sponsorship. It takes a village to make this conference happen, and I just want to thank and acknowledge our other sponsors for today in addition to Rocky. The Colorado Health Foundation, I've already mentioned, is not only supporting accessible options for online participation, they're also our lunch sponsor. If you've never had lunch here in the hotel, you will not want to miss it. It's very delicious. Speaking of things you don't want to miss, you don't want to miss our reception immediately following the conference just on the other side, and that is being sponsored thanks to the Colorado Hospital Association, Partners for Children's Mental Health, and Trailhead Institute. We will be well fueled for our networking breaks thanks to support from Colorado Access. We'll have snack stations out during the 2 breaks that we have during the day. Let's see, we have several participants here thanks to generous scholarship support from Craig Hospital, the Colorado Community Health Alliance, and Intermountain Health. You are probably all logged into the wireless access thanks to Connect for Health Colorado. We have an amazing lactation room for anyone who needs it, including a sink and a refrigerator, which is key to all lactation rooms, I have learned, thanks to Caring for Colorado. And we also have a prize that will be given out at the end of the day for registration from Green Spaces. So please, again, join me in thanking all of our sponsors for their generous supports. Thank you. Okay, we are slightly ahead of schedule, which is excellent because if we want to spend any extra time, it's right here. We are starting off very strong on our conference today, sharing with all of you the results, some of the highlights of the 2023 Colorado Health Access Survey. And I want to reiterate, these are highlights. We will have a full rollout of all of the CHAS findings in February of 2024. So stay tuned for that, but we'll share some hot off the press items. We are going to be calling today's presentation Peaks and Valleys. When we looked at the data for 23, we found that it really provided us with both. We see some pretty tremendous peaks, and we also see some valleys in the data. As a trendable survey, we can look in the rearview mirror, and the CHAS allows us to understand what this point in time represents. Is it a peak or is it a valley? But we also were curious to see what future CHAS will show for us. All right, so before we get into it, I just want to get a little sense of everybody in the room. So I'm going to read off a series of statements, and if you're in the room and they apply to you, please stand up and stay standing. And if you're part of our virtual audience, just raise your hand. So stand up if you have ever participated in a listening session or a community meeting to refine or develop CHAS questions. Anybody? Yeah, we got one. Okay, stay standing, Michelle. Amy, that's right. You have to be standing, you two. Don't sit down. How about if you have ever downloaded a CHAS data file, a data brief, anything from CHI's website about the CHAS? Go ahead and get yourself standing up. There we go. Stay standing. Please don't sit down. Okay, how about if you contacted CHI to help you download a data file, pull some crosstabs, or maybe provide you with some unique data? Anybody? Anybody contact a CHI? Or look at all you self-service folks. Love that. Okay, how about, we've got 5 on the online audience so far. How about if you have ever used Chaz data for an evaluation, a needs assessment, a report, a data dashboard? Anybody use Chaz data in any of the work that you do day to day? Okay, we got some hand waving too. Yep, see some more standing up. And how are we looking on the online audience? I'm guessing, oh, we've got double-digit hands now coming from the online. Okay, great. Well, look at all of you. I'm so excited. You can sit down now. Thank you. Now, I'm going to hand it over to the experts here, Jeff Bontrager and Lindsay Whittington. Thank you. Thank you.
Okay, well, let me make sure my mic is on. Okay, mic is on. Good morning, everybody. Thank you. Thank you for bearing with us as we work through a blown circuit. And like Sarah said, I think there was just so much energy in the room anticipating these survey results that we blew a couple circuits here. So again, a huge thank you for being here. My name is Jeff Bontrager. I'm Director of Research and Evaluation at the Colorado Health Institute, and I've had the distinct privilege of being involved in supporting the Colorado Health Access Survey since its inception in 2008, 2009. And I've served as the principal investigator on the last 4 surveys. So I'm really pleased to be here, and I am incredibly pleased and fortunate to be joined by my colleague, Lindsay. You want to introduce yourself, Lindsay?
Yeah. Testing, testing. All right, cool. Hi, everybody. I'm Lindsay Whittington, and I have seen many of you already, either online or just in person today, because many of you have reached out to me to get Chaz data. I'm your go-to Chaz person. So I have actually been in the public health industry for about 6 years now, 4 of which have been at the Colorado Health Institute. And during my time here, I've really focused a lot of my efforts on data equity and practices around that. And I have had the pleasure to become the data manager of the Colorado Health Access Survey. And the 2023 survey is actually my 2nd survey that I've been able to lead the analysis of, which has been really cool.
Great. And I think your mic might be rubbing against your name tag, so it's creating some background noise.
All right, cool.
Yep, perfect. Okay. Well, so at the Colorado Health Institute, we often joke that the word Chaz, Colorado Health Access Survey, Chaz, can be a noun, a verb, an adverb, and an adjective. So we are really pleased that you have all gotten up early, braved the traffic and the U-turns to join us to Chazily Chaz, the Chazzy Chaz. Yeah, so in other words, what we're going to do today, as Sarah mentioned, is present some high-level findings. These are 4 analyses that the CHI team has been really focusing on that are hot off the press from the 2023 Colorado Health Access Survey. And we are going to be going through these 4 topics relatively quickly. And unfortunately, because we have such a packed agenda, we are not going to have a time for a question and answer or discussion period about these data. However, don't worry. In February, about 2 months from now, the Colorado Health Institute team, the Chaz team, is going to be releasing all of the data in its full glory and the full complement of data products, including data files, regional profiles, our annual or our biannual storybook of Chaz findings. And there will be plenty of time at that point for discussion of the findings and to dig a little bit deeper into the findings. So what I'd like to do now is go into these 4 analyses and just cut to the chase, give you the top-level headlines that we're going to be talking about today. So first of all is that when we think about coverage, we saw that Medicaid, our state's Medicaid program, Health First Colorado, drove coverage rates to a new high in the state. So I'll talk about what I mean by that here in a bit. In terms of mental health, we saw that even greater numbers of Coloradans couldn't get an appointment for mental health services. This was the first time that the CHAS included questions on climate change and health. And what we found was that half of Colorado adults say that their community is not prepared for a climate-related disaster. And finally, a topic that I know is on a lot of people's minds is housing. And what we found is that housing instability has returned to pre-pandemic levels. So, like I said, Lindsay and I are gonna be diving into what we mean by these headlines here shortly. So, let's start with coverage. No CHAS presentation would be complete without an examination of the uninsured rate. So this is the proportion of Coloradans who indicate that they lack health insurance. As you know, the uninsured rate has really stabilized since 2015 after the provisions of the Affordable Care Act were put into place and has stayed around 6.5, 6.6% approximately. Well, what did we find in 2023? We actually found that the uninsured rate dropped to 4.6%. I realize, Now I realize that this may come as a surprise, and I know this is on a lot of people's minds, but let's talk a little bit about why this was. And by the way, this was a statistically significant decrease that we found. So what we think is the driver behind this drop in the uninsured rate is that our state's Medicaid program, Health First Colorado, really drove coverage to a new high and the uninsured rate to a new low. So let's look at the data here. I know many of you are familiar with this graphic. Each of these bars represents 100% of the state's population, and we have 2023 at the top, followed by the last two surveys, 2021 and 2019. Well, we'll start with the uninsured rate, what I just showed you. 2021, we saw that the rate dropped from about 6.6% down to 4.6%. One interesting thing that we observed in the data was that employer-sponsored insurance, so this is the proportion of Coloradans who indicate that they get their insurance through their employer, it actually stabilized over the last 2 years. We had seen a decline during the pandemic by a couple percentage points from about 52% down to just under half of Coloradans reporting gaining coverage through their employer. And that stabilized at about 49% here in 2023. And what we feel is the main key driver of that lower uninsured rate is the increase in the proportion of Coloradans who indicate that they have Health First Colorado coverage through the state Medicaid program. We had seen an increase in the proportion between 2019 and 2021. This increased to the point where about 30% of Coloradans indicate coverage through Health First Colorado. I know that there is a lot to unpack here, but I want to make sure that we have time to look at how the uninsured rate varied across the state. So let me orient you to this map. This map is mapping the 21 health statistics regions here in Colorado. These were developed by the Colorado Department of Public Health and Environment. In the urban areas, they include single counties for the most part, and in the rural areas, they're groupings of counties. Also on this map, the lighter colored regions represent a lower uninsured rate. So you can kind of think about the darker colored navy blue regions as having more people covered or a higher proportion of people covered. So once again, we observed that the region with the highest uninsured rate is that I-70 corridor, that mountain resort those mountain resort communities west of Denver along I-70. And in fact, this was one of the regions where we actually saw an increase in the uninsured rate from about 10% in 2021 up to about 12%, 13% in 2023. For the first time, we actually did not have a sufficient enough sample in some of the regions to even estimate the uninsured rate. So this is a sufficient enough sample of people lacking insurance to estimate the uninsured rate, and this affected counties along the Front Range. So Larimer County, Boulder, Broomfield, Gilpin, Clear Creek, Park County, Teller, and Douglas County. We couldn't calculate the uninsured rate. So these are grayed out here on the map. Before we get too excited about the low uninsured rate, I want to bring up some considerations that are on a lot of people's minds in this room and online. So as a pandemic-era protection, the federal government required states to keep people who were enrolled in their state Medicaid programs enrolled through the public health emergency. Now that the public health emergency is over, states are redetermining the eligibility of those who are enrolled in Medicaid. In Colorado, this process of redetermining eligibility started in about May of this year and will continue through mid-2024. So we are in the process of redetermining eligibility of Medicaid enrollees. Now, many folks, probably in this room and online, are involved in one way or another in outreach efforts to keep Coloradans covered. This is through creating pathways to coverage through Connect for Health Colorado, for example, perhaps other coverage sources. Could I just see a raise of hands, either online or here in the room, of anybody who is involved in these efforts of keeping Coloradans covered? Yeah, quite a few of you. So this redetermination process is currently underway. It is unknown at this point how many people will continue to stay covered and how many people will become uninsured here in the state. The Colorado Health Access Survey was administered between approximately March and August of 2023. So we feel that what is actually reflected in the data is not the redetermination process and anybody who may have lost enrollment. On the contrary, it's actually showing the increases in enrollment that we experienced during the pandemic through Health First Colorado. Future CHAS efforts will be able to reflect these redetermination efforts for redetermining eligibility and people's coverage. But one thing that I take away from all of this is that our state's Medicaid program, this public health insurance program, has been responsible for some of the most significant decreases in the uninsured rate and expansions of health insurance that we've seen since we started measuring it with the Colorado Health Access Survey. So again, I know there's a lot to unpack here, but I'm going to turn it over to Lindsay to talk about our next important topic, which is mental health.
Thanks, Jeff. So in 2023, an even greater number of Coloradans couldn't get an appointment for the kinds of mental health services that they needed. A few years after COVID-19 pandemic, many Coloradans still suffer from poor mental health. And with that, many people are also seeking care. Let's dive into some of the key findings from the mental health CHAS data that we have for you today. So first, this figure shows two very important mental health measures that we have captured on the CHAS that we've been collecting since 2013. So this is really cool because this year marks a decade of collecting this really important information on the CHAS so that we can better understand mental health care and access in Colorado, in our state. So in this figure, the green bar represents those who reported poor mental health. And in the purple bar, this represents the percentage of people reporting that they didn't get the mental health care services that they needed in the last year. So since 2013, there has been an increasing percentage of people who report that they didn't get the kinds of mental health care services that they needed in the last year. And in tandem, we see that there is also an increasing percentage of people reporting poor mental health. So when you combine those together, this really shows an increasing need of mental health care services in our state. Now, what might be the barriers that make it difficult for people to get the kinds of care that they need in Colorado? So in this figure, It also outlines two really integral barriers to seeking mental health care that is captured on the CHAS. The first of which is already displayed in blue, being cost as a barrier. And the second, in yellow, being those that reported that they weren't able to get an appointment when they needed one. As we can see here, as the change over time, cost is no longer the leading barrier that makes it difficult for people to get care. Instead, we see that many Coloradans now just have as difficult of a time getting in front of a provider as they do avoiding costly care bills and other costly just things associated with their care. And when we dug a little bit deeper, the data suggests that this decrease in the cost barrier may be associated with the increase in Medicaid coverage that we saw in the last couple of years. If you're interested in exploring more about mental health as well as the youth perspective, you should check out the breakout session Screens, a youth-led guide to mental health in the age of social media, which is today at 1 p.m. So I'm going to hand it back over to Jeff to talk a little bit about climate change.
Thanks, Lindsay. When we were developing the survey for the 2023 survey, there was a lot of interest in understanding the impact of climate change on health. And so this was the first time, as I mentioned, that we included a couple items on the survey about how Coloradans are affected by climate change or whether they feel that their communities are prepared for a climate-related disaster. And what we found is that with this baseline data, about half of Colorado adults indicated that they did not feel that their communities were prepared for a disaster. The question on the CHAS was only asked of adults 18 and over, and it was how well prepared their local community was to respond or recover from a climate-related disaster. And what's shown up here on the graph in the orange bar is that about 46.9% of adults indicated that they felt their community was not prepared or only somewhat prepared for a climate-related disaster. Another 48% approximately, represented by the blue, were in these categories of moderately or well or very well prepared for a climate disaster. And then we had about 5-6% who indicated that a changing climate isn't associated with disasters. Now, what I feel is really interesting is looking at the geographic divide here. When we look at the map, again, the lighter colors here represent the proportion of people who feel that their community is not prepared for a climate-related disaster. We find that some of the communities, Denver, Adams County, some of the Eastern Plains regions, upwards of 50 to 60% of adults indicated that they did not feel that their community was ready or prepared for a climate disaster. Whereas on the western slope, we saw more around 30% of people indicating that their community was prepared. And it causes me to wonder whether some of the communities that have experienced wildfires or the threat of wildfires more frequently may be better prepared or feel that they are better prepared because of that. One other stat that I wanted to mention is that we also asked adults 18 and over about the impacts of climate change on their health or on their family's health in the past year. And we estimate that about 2 million Coloradans, when we statistically weight the data, 2 million Coloradans believe that climate change is affecting their health. And I would encourage you to attend the Acclimate Colorado breakout session later today, where our colleague Karim Ahmad is going to be diving a little bit more into these data and some of these issues. So now back to Lindsay to take us home, so to speak.
Thanks, Jeff. So struggling to afford housing is now a shared experience by hundreds of thousands of Coloradans in our state. And this isn't a new issue. But things don't seem to be getting any better, and inequities still exist. And in 2023, housing instability returned to pre-pandemic levels. So let's check out a few CHAS housing measures and see how housing has an influence and impact on someone's own health. This figure outlines the comparisons between the state average in red, homeowners in blue, and renters in green. And this measure is actually those who reported that they didn't believe they would have stable housing in the next couple of months. As we can see, there is a stark difference between the kinds of the reported stable instability housing measure across different kinds of home ownership. The CHAS has been integral in tracking social determinants of health measures, among many others, during, before, and after the COVID-19 pandemic. We can see that while there was some relief experienced with these individuals in the 2021 post-COVID environment, housing instability issues for these groups have returned to pre-pandemic numbers. This means more people experiencing housing cost issues and more people having to make decisions about what they can and can't afford for them and their families. And many inequities persist in housing instability and cost issues. So this figure, we actually collected a new measure on the CHAS this year, which is someone reporting that they weren't able to afford their rent or mortgage in the last year. And I'm going to display a couple different bar graphs, but first let's take a look again at home ownership. So this figure reports those who said they weren't able to pay for their rent or mortgage by home ownership again. And as we can see, renters are almost or over 4 times as likely to report that they experienced this issue in the last year compared to homeowners. And we see that in the Colorado average, about 13% of people reported that they experienced this issue. Another really important inequity that we wanted to highlight is by race and ethnicity. So again, this is those who reported that they were unable to pay for their rent or mortgage in the last year. And as we can see, different groups experience this issue differently. For example, Hispanic or Latino Coloradans were more likely than other racial or ethnic groups to report that they experienced this issue in the last year. So when we take this all together, we can still see that there is a lot of improvement that we can work on around this issue, around housing and cost issues. So what's kind of the implication for this information? Well, a big one is that health and housing are related. So this figure outlines the connection between housing and health. So on the left, we see those Coloradans who reported that they were worried that they wouldn't be able to have stable housing in the next few months. Whereas on the right, we have those that did not report experiencing this issue. And the blue bars in the donut chart, they represent those who reported excellent, very good, or good overall general health, whereas the yellowish orange is those who reported fair or poor general health. So as we can see, those who reported experiencing housing instability were nearly 4 times as likely to report fair or poor general health compared to those that didn't report this issue. And this has big implications not only for these families' ability to afford their basic needs, but also the reality of those individuals facing worse health outcomes and burden of costly care down the road. So there has been much discussion around this issue, of course, at the legislative level. So for a deeper dive into housing issues and the possible policies that could help reduce burden on Colorado families, make sure to catch the Health Policy and Politics in 2024 legislative session today at 2:30. All right, so that was a lot of information. So what should we be thinking about today as you kind of move through the different sessions? So let's kind of take a tour back through the different 4 key takeaways that we discussed during the presentation today. So first, Medicaid drove coverage rates to a new high. Second, an even greater number of Coloradans couldn't get an appointment for the kinds of mental health care services that they needed. Third, half of Coloradans say that their community is not prepared to respond or recover from a climate disaster. And lastly, housing instability returned to pre-pandemic levels. So as Sarah and Jeff also mentioned, this is just a small snapshot of the data that we will have available for you all. So mark your calendars for February 15th, as that will be our big data launch for all the different products that we have available for the data on the CHAS. And if you have any questions or anything that you want to reach out to us about the CHAS, we have linked up our CHAS email address up here that you can use to reach out to us for any questions that you have. And in addition, we're going to post this presentation on our CHAZ website as well, which is also here on the slide. But thank you all for tuning in and getting a little bit of a Chazzy Chaz, a little serving of the Chaz data that we have available for you.
Yes, thank you all. And as I mentioned, we unfortunately don't have time in our agenda today for a question and answer period, but stay tuned in February for the release of all of the 2023 Colorado Health Access Survey findings.